I wanted to bring today's episode to the podcast talking all about iron. We see a lot of people with low AMH and high FSH, diminished ovarian reserve, premature ovarian insufficiency with either low iron, anemia. And typically, the conventional medical approach to this is to give someone a iron supplement. And while that may be part of the equation, we are talking about all the reasons why the iron may be low, which supplements are the best ones to take, which foods are the best ones to help with low iron, and if it is low, what are some things we can do to actually improve iron absorption and help you improve the chances of pregnancy success? Excited for you to listen to this episode. Let's go. Hey, Katy, excited to have you back on the podcast.
Hello, excited to be here.
Today, we're digging into iron, and we see this a lot with people with low AMH and high FSH, diminished ovarian reserve, premature ovarian insufficiency, either someone who struggled with anemia their whole life, low iron, and they're taking iron. It's like, okay, wait, I have low iron. I already know that. Or maybe someone that didn't realize that they had iron issues. So let's talk about, first of all, why is it important for pregnancy success to ensure that we have proper iron?
Yeah, it's iron is one of those nutrients that is so integral to human health, and our red blood cells that actually carry the oxygen around the body, which is the basis of life. They need iron to be able to do their thing. So it's as I say, it's integral to human health. And of course, when we're thinking about the blood and oxygenation in different parts of the body, then in order to have a functional reproductive system, then that needs to be well perfused by oxygen so that our cells can talk to each other properly and be as healthy as they can be in order for a pregnancy to occur. So when when that is out of balance, especially long term, then it does put us at greater risk for infertility, whether that is disorders of ovulation, whether that's irregular periods and irregular cycles, whether it's miscarriage, and then even pregnancy complications once a pregnancy has occurred.
Yeah, the amenorrhea, so the lack of cycle, anovulation, we talked about
Mhm.
ovulatory disorder, infertility, miscarriage, low birth weight, preterm labor, all with anemia, so low iron. So let's just talk about the conventional approach versus the functional approach for addressing low iron.
Yes. So what I see time and time again, and what Fab Fertile clients often present with is they will have a long history of anemia, and so they'll come to us and they'll be like, "Yeah, well, I know I've got anemia," and I take, I've been prescribed iron. And then so often it's then around we need to do that digging. So because in terms of what is often the medical approach, the general medical approach will be, you go to your doctor, or it's found out that you've got anemia from a blood test. Then you will just get given an iron supplement, and that iron supplement is usually ferrous sulfate at a fairly high dose for a lot of people, and then often they're just left on that as well. Like, and years later, people are like, "Oh yeah, I've been taking this iron supplement for years," and you're like, "Why?" Um, so there's a few layers there to unpick, and I think the first one is that lots of people are diagnosed with anemia based on not a full set of bloods. So lots of doctors may diagnose anemia just off of something like the hemoglobin levels in the red blood cell count, or just off of the ferritin levels. And that gives us a really incomplete picture, because if we're just looking at the oxygen levels in the red blood cells themselves, well, we know that there are a number of different reasons why the red blood cells might not have quite enough oxygen, or why they might be struggling to carry enough oxygen. And iron is just one part of the picture. B12 anemia is another part of the picture, and folate as well. So really, we would never just say, oh well, you've got iron deficiency anemia just off seeing that in a red blood cell count. Another thing is to once that is looked at, then we want to be looking at a full iron panel, and that is something that Fab Fertile routinely does with all of the blood work for their clients, and something that I recommend anyone trying to conceive to look at all that blood work in detail, because the iron piece is so important. So then we look at the full iron count, and that gives us a much better idea then as to what is actually going on in terms of that person's iron. So as I say, sometimes anemia is just diagnosed off ferritin levels being high. Now, ferritin is just your iron stores. And ferritin levels being low, I correct myself. The ferritin is just the iron stores. And so ferritin levels could be low, but the actual serum iron levels are okay. It's just maybe that the stores need to be built up a little bit. And then conversely, for some people, the ferritin levels might be sky high, and then that is misdiagnosed, and the anemia is then missed to say, oh, well, you don't have anemia. But actually, the ferritin levels can be high for other reasons like inflammation, and not just the iron status. And so we really need to get a look at the whole picture, along with the clinical presentation, so that we can really dig into what that person is going through now. And then the other side of that is we want to just be asking, well, why? So once we've established that anemia is there, it's not just, oh, okay, cool, well, this person's got anemia. We want to know why, because that is such an important piece of the equation as well.
Yeah, so we'll dig deeper later as we talk about some of the reasons why. We do see a number of people coming in with low AMH and or high FSH, POI and DOR having thalassemia. Can you just kind of just briefly tell us what that is and what could be missed with if someone has thalassemia?
Yeah, I mean, thalassemia is a hereditary genetic condition, and it's quite a complex one. There are different types of thalassemia as well. But ultimately, people who have thalassemia maybe find it more difficult for their oxygen levels in the red blood cells to be carried around. So how that can present is sometimes it can make them at higher risk of anemia, and so we want to bear that in mind. But to add a little bit of extra layer of complexity, sometimes people who have the thalassemia can present in their blood work that they might be anemic, but actually, because it's a genetic condition, their bodies have adapted. And so it's almost like if you if you climb a mountain and you do your training up at high altitude, then your body gets used to having the lower levels of oxygen and it acclimatizes. So often people who have thalassemia do have the capacity to acclimatize, but we always need to bear it in mind, because there is that risk that there might be anemia there. And of course, with everything that we've said around the reproductive disorders and iron deficiency anemia, then that will be feeding into that.
So let's just go through some of the symptoms of low iron. I think the one that we all, most people hear of is that extreme fatigue, just like absolutely exhausted. Let's talk about some of the other ones that could be correlated with low iron. There's a sort of a battery of these, and so they could be also correlated with other things, but this is what we're seeing with iron. I'll have you take that one away.
Yeah, exactly. So yeah, the fatigue is a big one. The tiredness that is not shakable. Like nothing you do is helping that tiredness. And then other ones are ones where we're thinking about things that we would associate with having like a really nice level of oxygen in our blood. So like having that in our blood like helps to keep our skin perfused. So you might be looking like pale, depending on skin tone. You can help to tell paleness by like looking in the rims of your eyes as well, and also by squeezing your fingernails and see how quickly they turn pink again. So that's they're looking at the capillary refill time, so that can be helpful as a measure. Yeah.
What's going on here? I was trying to and the eye. So the rim of the eye should be white. Should be pink, not like white there.
Yeah, exactly. Yeah. And so paleness, and then it's things like dizziness as well. So dizziness, even fainting for some people. And then if once it gets more extreme, it can be going on to things like heart palpitations and shortness of breath, because your body literally isn't getting enough oxygen. And then it's things like, we know that when the body is trying to preserve oxygen, it will send the blood to the to the internal organs. So you might be getting the whole cold hands and feet there. And then inflammation as well, generally speaking. If you're severely lacking, or if you have an overload of iron, then inflammation can start to occur in the body as well. And so some people might get some specifically around their tongue. And then the brittle nails as well. So like our nail health is often a marker of our mineral status. And of course, iron is a mineral. So brittle nails can occur. And then another one is craving. So like people who crave things like ice, and like non-food stuff. So ice, and even like dirt and starch and those kind of things. They can all be signs of quite severe iron deficiency anemia.
Yeah, it's interesting with the ice, right? So you see people that just love crunching on ice all the time, and I'm like, geez, I think you're gonna rip apart your teeth. But and the dirt, I don't. Have you come across anyone that's like?
I've never come across someone that craves dirt, thankfully.
Like I smell the earth and I'm like, wow, that smells great, but I never want to eat it. But definitely with the brittle nails, like so many people, and getting the fake nails, all this kind of stuff, because the nails are breaking and they're ripping and they never grow and all this sort of stuff. Not to say it's iron, but that making sure you look at your iron status would be a key thing.
Yeah, absolutely. And I think that the nails are a really good window into our health status, actually. Like the nails can tell us so much. And so yeah, if you do struggle with brittle nails, it could be iron, it could be lots of other things, but always keeping that in check. And if you don't have kind of good healthy nails, then just wondering why that might be.
I've always had really great nails. I'm just going to say that they're really good. Yes, I feel it's a genetic thing because my mom she has like people say to me, "Oh, did you get a French manicure?" I'm like, "Nope, that's just the tips of my nails are white and they're like literally like rocks." Now, there was a time though, so they've always been like that. So that's how mine are. And then there was a period of time for about maybe like 5 to 7 years when my health took that freaking nosedive, where my nails were like ripping and cracking and breaking, and I'd be like, what the hell? I was always filing, and then now they're like back to these like rocks. But it is interesting to note on that, right, with the nail health.
Interesting, yeah. And oftentimes people will find, if they look at their nails, because the regrowth, I mean, fingernails tend to grow around about a millimeter a month, I believe it is on average. And so what people can find a lot of the time is if they've been through a significant health event or a major emotional trauma, then they will see a mark on their nails at some point that corresponds with that time. And then it will grow out over time. So it's really interesting that what the nails reflect.
Yeah, definitely. And then also with low iron can be poor appetite.
Yeah, exactly. And again, thinking about if anyone has that unexplained weight loss, then we would always be wanting to run an iron panel. There are lots of reasons why there might be unexplained weight loss, but that would be one of the reasons why we might look at that.
Okay, so let's take us through the functional reference ranges for iron markers. And basically the functional reference ranges, it just flags it. This is a tighter reference range and flags it earlier before it goes to disease. We include blood chemistry review as part of our Fab Fertile method. We don't diagnose, we're educating, so we can really look at all these different markers, what is out of balance, and then we develop protocols based on that, and looking at functional testing and looking at your health history. So let's just talk about the iron panel, each one, and kind of the reference ranges and what it is we're looking for.
Yeah. So when we're thinking about iron, iron itself, so like the serum iron, the level, the overall levels of iron in the blood, in terms of when we're thinking about the functional reference ranges, then in an ideal world, we're looking at anywhere between 85 and 130 micrograms per deciliter, and then depending where you are in the world, the equivalent of that might be 15 to 23 micromoles per litre. So it depends on the unit of measurement there. But so the iron, the overall blood levels of iron can give us a really useful indicator. But it's just worth knowing that the reason we like to look downstream at the rest of the panel as well, which I'll discuss in a moment, is that iron as a marker on its own can fluctuate quite a bit. So if someone went for a blood test in the morning and they'd haven't had a really iron-rich meal the night before, then the iron in the blood might be higher than what it might normally be otherwise, and vice versa. Oops. So that's the first marker that we look at. Another marker, the next one then, is we look at the total iron binding capacity, and what that's doing is thinking about the blood's ability to actually bind with the protein that carries the iron called transferrin. And so the total iron binding capacity is what helps it carry through the iron through the bloodstream. And in terms of the functional ranges for that, we're looking at between 250 and 350, again, micrograms per deciliter, or between 44 and 62 micromoles per litre. So again, if we were picking up that the actual iron itself was low, and then the iron binding capacity was high, then we might start to be thinking in our heads, oh, well, actually, that maybe there is a sign of anemia going on here. And then the same for because the iron binding capacity and the saturations, which I'll talk about next, they are signs of what the blood and what the proteins in our blood are doing in response to our iron levels. So the iron saturations, or the transferrin saturation, is the percentage of that ability to the percentage of iron that is actually bound to transferrin, which means that it can be carried around to where it needs to go. And so again, ideally we want that to be sitting, this is a percentage, in between 25 and 35%. And so if that is low, again, then we're building up this picture of, okay, well, maybe there is some anemia going on here. And then for the ferritin, that is, as I said before, that is looking at the iron stores. And so this is something that, if someone is using up all of their actual iron in their bloodstream on a regular basis, and then they start to have to use up their stores too, then those stores are going to become depleted. So this is perhaps a bit of a longer term picture. And ideally, we want that to be sitting in between 50 and 100. And that's the same regardless of what unit you're measuring. So that's nanograms per mil or micrograms per litre. So that all in all helps to give us that overall picture. Now, as I said before, in terms of the ferritin, that can the ferritin can become elevated when there is inflammation going on in the body. So when we're thinking about this iron, and we're thinking every step of the way in the blood work, we want to be thinking like, okay, well, first of all, how well is this person absorbing the iron, and B, like whether they have any inflammation going on. Sometimes if someone had, like COVID is like the biggest example at the moment. Sometimes if someone's had COVID and then they go for their blood draw, then their ferritin might be elevated. And so, sometimes when we see the markers a bit like, oh, that doesn't really make sense, and we say, oh, did you have COVID? Were you suffering or getting over an infection when you had the blood work done? Yes, okay, that would explain it. And so then we might want to consider looking at that again in, maybe 6 weeks down the line.
Okay, so let's talk about some of the reasons that they're out of balance. Because typically in conventional medicine is like, oh, well, here's the supplement for iron, off you go. And no one even looks downstream as to, what exactly is going on. So let's talk. We see a lot of people we work with, either they have Hashimoto's, we see it alongside with low AMH and high FSH, and hypothyroidism. So let's talk about the thyroid markers and then the connection with iron, low iron or anemia.
Yeah. So when there is inflammation, and autoimmunity would be playing into that picture of inflammation. So Hashimoto's thyroiditis is an example of an autoimmune condition. That is going to mess around with both the iron stores and the iron levels in the body. So that can be quite disruptive for iron, and we want to make sure that that person is not getting too depleted in iron. However, the other side to that coin, when we're thinking about the thyroid, and this is probably the most common thing that I see, is someone who has got low levels of thyroid hormone in their blood, or they've got some kind of sluggish thyroid going on, or not optimal thyroid. It's often the case that they don't have enough iron in their body, because iron is a key nutrient for the production of thyroid hormone. So we need to have enough iron in order to produce our thyroid hormone. So that can actually play into hypothyroidism then. So it's a bit of a two-way street in that respect, but it's definitely a really important one. And the thyroid piece is just like, as you know, Sarah, it's such an important one when it comes to fertility, and it's probably one of the most common things that we see out of balance.
Yeah, we have a weekly meeting when we meet with our team for our clinical mastermind. I just got off it just before this recording this call, and we were talking yet again all about the thyroid, looking deeper than the TSH and looking at the full panel and how to optimize it. And many times you're just given, medication, which is a Band-Aid approach, and we need to dig deeper as to why it's off. And and in this case, iron could be low, and that could be a reason. And then also, why is the iron low? And so, okay, so let's talk about, so it could be blood loss. We do see that sometimes with that occult blood. Then is that where we're looking in there on the blood loss?
Yeah, absolutely. So blood loss is one of the key reasons as to why the iron levels might be low, because you're literally losing blood, and so you're losing iron. Now, when we are troubleshooting and we're asking, okay, why does this person have low iron? From a client safety perspective, we always need to try and rule out internal bleeding, because if someone is internally bleeding, like, that's a problem, right? And that is something that needs to be medically managed. So we do always want to rule that out. Now, the good thing about the comprehensive approach that you guys have at Fab Fertile is that you do the comprehensive stool analysis for everyone coming through the doors. And one of the things that looks at, as you rightfully said, is the FIT test. And the FIT test looks at the level of blood in the stools. And given that GI bleeds, gastrointestinal bleeds, are probably the biggest cause of internal bleeding, then that really helpfully rules that out or confirms it. So that helps us to just look at that piece of the picture. And then in terms of for some people, for example, who have really heavy periods, who have heavy menstrual bleeds, they can become depleted in iron because they are having a monthly blood loss that is quite significant. So, we always want to be asking that question around what exactly the periods look like in detail. And then again, an obvious one, but definitely not one to be overlooked, is a diet that is not rich enough in iron. So, a lot of people now are moving towards plant-based diets and veganism and these kind of things. And whilst there is some iron in plant-based foods, we'll talk about absorption in a bit, but it is harder to absorb the plant forms of iron. And so if you're not having animal sources of iron in your diet, then you may be at higher risk of deficiency as well. And then it's the absorption piece, and there are so many things that can impact the absorption of iron. And when we were at nutrition school, one of the first lessons that we learned was, it's not you are what you eat, it's what you are what you absorb. And so you could have the best iron-rich diet and nutrient-dense diet in the world, but if you're not absorbing it properly, then it ain't going to count for anything. So if you an iron, it is a complicated one for the body to absorb, as well as B12. So it has to undergo a process of separation and then binding with something else, becoming separated with that, and then transporting to where it needs to go. And it is quite a long process and quite a labor intensive process. And so if any part of that process isn't functioning optimally, then it's not going to be absorbed so well. So most of the first parts of that process happen in the stomach itself. So what we need for the stomach is adequate stomach acid to be able to actually break that down and do the first part of the equation. Otherwise, it's just going to stay as its whole form, and you're not going to be able to use it at all. And we do see that a lot. Is this hypochlorhydria, where people are just not producing enough stomach acid to be able to protect themselves against infection and absorb their nutrients properly. And then another one in terms of the stomach is H. pylori. So again, that's something that we screen for in the stool testing that we do. And H. pylori is something that is, the Fab Fertile practitioners are working with their clients a lot on, because that is a huge driver for inflammation, for not being able to absorb your foods, your nutrients properly, and for the iron to be depleted, so anemia. And then looking a little bit further downstream, so the iron itself then gets absorbed in the brush borders of the small intestine. So we want the small intestine to be in really good health as well. And what we do see in a lot of people is that they've got this overgrowth of bacteria in the small intestine, and that's going to impact the absorption of iron as well. And then we're just thinking about the overall integrity of the gut. So how is the mucosal barrier? How are all those protective mechanisms? And all of those things will impact the body's ability to absorb iron. And if there's any dysbiosis going on, so if there's any imbalances with the bacteria that living in the large intestine, if there is an overgrowth of something like candida, if there is inflammation in the gut, so if someone's got Crohn's disease, if someone's got ulcerative colitis, if they've got celiac, all of those things are going to quite significantly impair the ability to absorb iron.
And we see this all the time with that low AMH, high FSH, premature ovarian insufficiency, diminished ovarian reserve. And we get very focused. And similar to me, I got very focused on the diagnosis and didn't think there was anything else I could do, and just went off to donor eggs. Meanwhile, I had huge amounts I had gut infections. I have non-celiac gluten sensitivity. So for me, gluten is off the charts. And we see many people that either have celiac or Hashimoto's, or maybe they when they don't actually have an autoimmune disease, but when they have gluten, it causes an immune response in their body. So the gut health and addressing these infections is key. If you've just changed your diet, gone gluten and dairy free, and haven't looked at the health of the gut and haven't addressed the infections, and wondering why your iron is low and you're anemic and all these things. It all tells a story, and we're not here to diagnose, but we're here to look at what are those missed healing opportunities and dig deeper so you can get pregnant naturally. Or if you do go to IVF, you can get pregnant with your own eggs.
Yeah, exactly that, Sarah. It's so something where, it's like, oh, we're doing a podcast on iron. It seems like a relatively simple topic, but it's not, because it connects in with so many other things in the body.
Right. The next one we have is pregnancy and lactation with low iron. What do we see in there?
Yeah, so it's just worth bearing in mind that when you are pregnant, then there are a number of things going on which can deplete your iron stores. One is because a grown baby in utero will require iron, and so a lot of that iron will be going to them. And then the other thing to note around pregnancy is that your blood volume increases by 1.5 times. So it increases by 50%. And so, if we're thinking about the role of blood, oxygenation in the blood, then you're all of a sudden going to need a lot more hemoglobin in your blood. So it's just worth bearing in mind that pregnancy is a time where iron can become depleted. And the same for lactation, again, because it's getting passed through the breast milk. So it's just worth bearing in mind that person may need to be thinking about the absorption and possibly increasing their intake as well.
What about endurance sports?
Yeah, so again, like endurance sports, when we're putting our bodies through a lot, then we're going to be just, you're breathing more. Your body needs more oxygen when you're doing any kind of endurance sports. The same example that I used earlier as well of being at high altitude, for example. So it just makes sense physiologically that they might need more iron than your regular person. And then the other thing to note is that excessive turmeric supplementation can actually deplete iron stores as well. So, and this I think just goes to show that everything, when it comes to healing and natural healing and all of those kind of things, everything is a balancing act, and it's not a good idea to just go off and take a million supplements off your own back. It should always be done under the guidance of someone who actually knows what they're talking about, because lots of people who are struggling with inflammation or informed about inflammation might be going off and taking these really high dose turmeric supplements, which may be really good for them in some respects, but also it could be depleting their iron stores, because curcumin actually is a chelator of iron. So that's why that is. So it doesn't mean don't take the turmeric. It just means we need to be really mindful. And definitely, if you are taking turmeric and trying to build up your iron stores at the same time, then you just need to be mindful of that and take them at different times.
Yeah, that's an interesting one, right? As the, golden milk and all of these golden milk lattes and things like that, everyone's pounding down the turmeric to reduce the inflammation. And then, too much of a good thing is not always a good thing. So it's like what puts something else out of balance in the body. So it's interesting with that. But yeah, it can be good, but it's to say if your iron is low, then something for us to dig into. And what about cancer? What are we seeing there with low iron?
Yeah, so again, it falls into that clinical presentation of if someone does have cancer, then there is going to be inflammation going on. Iron, that cancer will feed off of iron as well. It doesn't mean that iron is a bad thing, but it's just worth bearing in mind that someone with cancer could well be presenting as anemic. And so, if you have got like any like unexplained bleeding, unexplained weight loss, any lumps, bumps, anything unusual that you feel needs to get investigated, always err on the side of caution, always go and get it checked out if you're worried about that kind of thing.
Absolutely. Just did a podcast episode all about if someone is diagnosed with cancer and they're on the fertility journey. So we talk about an integrative or functional approach to that. So definitely check that out. Okay, let's just talk about a few, some medications or foods and drinks that could actually interact with iron absorption.
Yeah, absolutely. So, first of all, it's just worth bearing in mind that if anyone is taking, we call it levothyroxine. I think you guys typically call it Synthroid. So, any thyroid medication or thyroid replacement, hormone replacement. You need to be taking any iron and actually really any minerals 4 hours away from taking that medication, because the minerals can impede the functionality of that medication. So typically speaking, if you are on Synthroid or similar, then you would be having that first thing in the morning before you eat anything, to prep your body for the day to metabolize your food. And so as long as you're then waiting at least 4 hours, then that would be a good practice. The other thing, so dietary things to consider that can impact iron absorption. So again, it doesn't mean you have to not have these things. It just means you might not want to take them at the same time if you are supplementing or if you are using diet to build up your iron. You might just want to have these at separate times. So it's things like tannins, which are found in tea, some polyphenols, so found in certain vegetables, and also some phytates. So phytates are found in bran, but also some vegetables as well. So this is what I mentioned earlier around the reason why lots of the non-heme iron sources, so which is the vegetarian, the plant food sources of iron, they are a little bit harder to actually absorb, and that is one of the reasons why, because they often have these chemicals in the plants that can actually impede the absorption of iron. And then dairy as well can impede iron absorption. So it's just worth bearing all those things in mind. If your goal, if you've been told, we need to try and increase your iron and improve that, then all of these things might interfere.
So let's talk about some of the dietary recommendations for us, and then we'll go into the supplement recommendations. So many people come to me, they're like, oh, I've taken out red meat. And, that's an interesting one because we're like the conventional red meat that could have antibiotics or hormones or, it's not grass fed. We don't recommend that. We're looking at grass fed, grass-fed organic red meat. It can be really good for your body. And obviously, if you've got low iron, good as well. So you can talk about red meat, and then we'll talk about organ meats. I've got an episode on the podcast too, talking all about liver. So that was fun. But let's talk about red meat and organ meats.
Yeah, exactly. So, if we're thinking, it just makes complete sense, doesn't it? We're thinking about iron, we're thinking about oxygen, we're thinking about blood, and your red blood cells. So it makes sense that any flesh that is red appears red in color, then that is going to be a rich source of iron. So thinking about red meats is great, but also things like salmon are also rich in iron as well. So thinking about that pink color, and even chicken, not so much the chicken breast, but like the parts that are closer to the bone. So the grey meats on the chicken, they are richer in iron than breast, which you wouldn't find much in. And then eggs. So for people that don't like to eat meat, eggs are like a decent source of iron as well. And then tuna is okay as well. And then you do have lots of, as I say, plant sources of iron too, but it's the difference between the heme iron and the non-heme iron. So non-heme iron sources would include things like beans, red lentils, so these kind of like legume families, tofu even, depending on how you feel about soy, and then like your dark green leafy vegetables are good sources of iron, dried fruit as well, but again, don't always recommend dried fruit because of the sugar content, but things like blackstrap molasses can. So if you're doing a smoothie, for example, then putting a teaspoon of blackstrap molasses can be quite a good way of increasing your iron content. And then peanut butter and cocoa as well. So if you were doing like a raw cacao powder, for example, then that might be a nice thing to include. And cumin as well, in terms of culinary herbs, is a nice source of non-heme iron. But it's just worth bearing in mind that with some of those non-heme iron, to aid absorption, you might want to do something like have it with some vitamin C, because what we know is whilst things like the caffeine and the milk and those kind of things can impede iron absorption, vitamin C can improve it. And the classic thing that I see all the time is like people being prescribed like a ferrous sulfate tablet by their doctor, which is a terribly absorbed form of iron, and they're told to have it with orange juice. And this drives me crazy, because if you just get like a carton of store-bought orange juice that has been heat treated, it ain't going to have very much vitamin C left in it. So if you have it with an orange, a fresh orange, fine. Like absolutely, that is a good dose of vitamin C. But often it can be something like if you were having a salad where you were having like, lots of nice dark green leafy veg, if you were having some pulses in there, this kind of thing, then just like squeeze some lemon over it. And then you've got a nice bit of vitamin C with it that can help the absorption.
What's pulses?
Oh, just like lentils and those kind of
okay. I've heard it called pulses.
Yeah.
Okay. Lentils. And what about organ meats? Like I guess the chicken or the beef liver?
Yeah, exactly. So liver, kidneys even, and people get super squeamish about this. If you can tolerate organ meats, then they are just so nutrient dense, because if we think about it, our internal organs are the most cherished thing within our body, right? And so if we are having organ meats, again, really important to make sure that those animals have been raised right, and that they are from organic, like well-bred sources, because the liver, if we're eating liver, that is also a detox organ. So if you're eating the liver of an animal that has had a diet that is not great and they've been under really stressful living conditions, then the quality of that liver is not going to be brilliant. Whereas if you're eating the liver from a happy animal, then that's going to make a huge difference. But liver is really, really rich in vitamin A as well, which is another nutrient that a lot of people don't quite get enough of. So yeah, as a combined, then liver is a great food. One tip that people can do if they really can't stomach actually having liver on their plate, and this sounds a little bit gross, but it does work. So if you're having like a stew or like a soup or any wet dish, then you can get your livers and freeze them, and then just actually grate a little bit in and grate a bit into the dish, and then you're not, it might feel a bit squeamish to do the grating, but at least then it's in there and you're not really going to notice it.
You hide it like when you were a kid.
Yeah, exactly. Yeah.
Or you can take a supplement too that has organ meats. So we'll link to the supplement here too. So let's talk about some of the supplement recommendations that we're using with our clients, and you can consider as well. So let's talk about the iron patch to start with.
Yeah, so one of the reasons I quite like the iron patch is because it bypasses the digestive tract. So everything that I said before around the iron being broken down in the stomach, and all of the things in the gastrointestinal health that can impact that. When we're having a patch, then it is just absorbing through the skin and going directly into the bloodstream, and so it can be quite a nice option for people who maybe have a bit of work to do on the GI side of things. So I found that to be quite a nice option. The really important thing to note with iron supplementation, especially oral, is that the body works on a feedback loop when it's monitoring iron, and when there is because it's one of those things that needs to be quite tightly monitored, if there's a massive influx of iron from a high dose supplement, then the liver will produce a protein called hepcidin, and hepcidin actually blocks the absorption of iron. So one of the worst ways that you can improve your iron is by having high dose iron supplements, because it's going to block the absorption. So some will get through, but it's just worth noting that. And what some of the more recent research is indicating, for people who are taking an oral supplement, and I'll tell you a moment about the best form, is to have it actually every other day, because it gives that hepcidin a chance to actually come back down again. And then when we take it the next day, then we're going to be more likely to absorb that. And also just not taking it at too high a dose. So, we often see people given a prescription for ferrous sulfate, which is really badly absorbed. It causes all manner of digestive upset. It makes your stools go black. It makes you constipated. It's not very pleasant. And people are often prescribed, 100, 200 milligrams of that. What I often find more effective in people who need it, because I'm always very cautious about iron supplementation if they don't need it, would be to do something like 27 milligrams of iron biglycinate, and either doing that daily at a low dose or sometimes every other day, depending on the person.
And then what about the vitamin C piece? Making sure you're doing a vitamin C with it, or what are you doing there?
Yeah, so yeah, the vitamin C. I mean, yes, sometimes I might recommend that they take I don't know, something like a liposomal vitamin C capsule alongside it if we're thinking purely supplements. But vitamin C is so beautifully abundant in food that we can literally say, oh well, let's just make sure that you're getting some citrus with that, or some dark green, some dark greens and these kind of foods. Just like nice fresh produce. The thing to note with vitamin C is that it is it does degrade or deplete over time. So if you're thinking about having that boost of vitamin C, then it needs to be like fresh cut food. So if we're thinking about things like peppers and salads and those kind of things, like if you're buying a store-bought salad, then probably it's depleted in vitamin C by now. Whereas if you're making it fresh, then that's great. But as I say, like even if you just carried a lemon around with you and squeezed it over whatever food you're having, then that's a great way to just get that little boost of vitamin C.
I love it. I love lemons and I squeeze it on many things. Okay, so what's your final thought on iron and someone who is on the fertility journey?
Yeah, just that iron is such an important nutrient for so many reasons. And if you are on a fertility journey, then I would strongly advise, just as part of your general workup, to get your iron looked at in your bloods, and then work from there in terms of all of the things that we've spoken about today.
I love it. And my dog was just stretching and she enjoyed it too.
Thank
So thanks,
you.
Katie. And thanks again.
Thank you.